Today is August 20, 2021, and I am heading for my CT scan in prep for FFS. I am going to the University of Virginia at Charlottesville, UVA, and I had my initial consultation there a couple weeks ago, and it was really exciting. I found that both the facility and the doctors very impressive. It seems like it's the best transgender care clinic in the whole state, for sure. Just based on my online research, and going there in person did not disappoint. We'll see how we go through the process. I am on Medicaid, which, has gone through a bunch of changes recently. It's been expanded through COVID, so it's not the same Medicaid it used to be. And then again, Governor Northam changed it so that Medicaid specifically included transgender care beginning on July 1st of 2021. So I thought, well, this is a great time to continue my quest for FFS, facial feminization surgery. I had been on the process to do this in California when I was with Kaiser Permanente. And I had my consultation at Kaiser basically the day before San Francisco went on lockdown. And because of that, I never even got necessarily put on the waiting list. I mean, they told me the waiting list was a year at that time. I'm sure it's longer now. But when lockdown happened, all the surgeries got stopped. Every non-critical surgery got put on hold. So I've just been, biding my time here in Virginia. And when I realized that FFS might be a possibility, I'd already been researching transgender care in Virginia because it's been really hard to find decent transgender care since I came here. It feels like everywhere I go, it's basically 30 years behind the times. I guess the people here weren't taught about WPATH in schools or didn't learn about it afterward, because WPATH, or the World Professional Organization for Transgender Health, is not well known around here. So I've been introducing my caregivers to the standards of here. It might not look like it, but I'm really excited. This is something I've been working on for a long time, and I had a bunch of difficulties even just getting the first step going. I got a referral from my primary care provider, sent to the surgeons, and then I guess once a referral is done there, then the doctors decide where I get put on the queue to even get an appointment. So that took quite a while, and I did a lot of calling just to see, am I going to get on the queue? Am I even going to the right doctor? That happened a lot, and I'm actually going to see a different doctor than whose assistant originally called me, and that was back in That was back a month ago, basically. And her doctor was so booked up and didn't do all of the procedures I wanted done that I got sent over to a different doctor who could give me a much sooner appointment. And I mean, I don't know him, I don't know his work, but he seems like he knows what he's doing. He's an associate professor there, because UVA is a teaching hospital, and I really liked both him and the resident he had working with him. So today's the CT scan and then the pre-op appointment. Now, another problem I had in Virginia is a difficulty getting a care coordinator that could really help, or was compassionate, I should say, and sympathetic. Through Medicaid, you're allowed to have a care coordinator, or you're assigned a care coordinator, and I went through at least 5 before I got assigned to the person I have now, who is really nice and is trying to be very helpful, as much as she can be. Some of this information is a little new to her, but at least she's on board on the team, which is nice, as opposed to just not really caring about my transgender care issues. And she's helping me work out getting all this stuff approved, potentially, which is not completely easy. I am having my psychiatrist and my therapist write letters, because the insurance is going to need them, I'm sure. And when the surgeon first sent through the prior authorization, it got rejected, which I just found out about yesterday. And that was due to, I think, a lack of some of the background data and probably some of my psychiatric data as well, which is extensive, but, you know, you didn't necessarily get all of that in the span of our initial 20-minute appointment. So I have a draft of my recommendation letter from my psychiatrist, and to get the whole team on board, I sent that along with, I made some comments on her draft about some accuracy issues, just to make sure everything's correct. And then I sent that back to her, including copying my therapist and the doctor and his assistant and my care coordinator, trying to get everybody to work on as a team, because it seems like that's one of my big lessons here, is that there's a lot of teamwork that's necessary for a successful project like this, and I'm just trying to make it all work. And if anyone's watching this who's not transgender and thinks that I should not be able to get this surgery just because I'm transgender, I put it to you, I think everybody should be able to get all the plastic surgery they want covered. I do not have this poverty mentality that something only needs to be absolutely medically necessary, or even just to get it covered. I mean, in this case, I would say it is medically necessary being transgender. It really fucks with my life not having it. But even if that wasn't the case, why do you want to deny people the ability to be confident in themselves? That's something I don't understand. I mean, I do believe psychiatrists and psychologists should be involved. I think it's essential for people to be well aware of what they're doing, what the risks and ramifications are. But in my case, I've been seeing a gender therapist for 13 years, or just a therapist in general for 13 years, and including a psychiatrist for most of that period too. I'll have to admit, most of the psychiatrists in my personal estimation weren't that helpful. A lot of them prescribed me the wrong drugs, and they didn't bother with doing blood work, which was a big mistake. Huge mistake, in my opinion. But that's how they're taught, and if they're taught the wrong way, they're not going to know the right way. It was only after looking at some of my own blood work that I realized some of the deficiencies I was having, because I guess the doctors weren't really seeing it. And because we don't have common shared medical records in this country, you're going to get substandard care every time, unless you really go out of your way to make sure all of your doctors have the latest data at every single opportunity. So you have to be your own best advocate. You have to be your own best medical researcher too. I mean, I've seen this with a lot of people who have medical conditions, that if they have a severe medical condition, they do a lot of research. They learn a lot about their condition and what are the issues, what are the causes, what are the potential options. And this is really important information to have. It's really, if you have any sort of condition, you need to understand as much as you can about that condition. Otherwise it will rule you, and everything around you will also rule you. And you won't get I wager that you will not get a good outcome. I mean, maybe the angels will be kind to you, and if you ask them nicely, they will find the perfect provider and make everything happen for you. That's quite possible. But also use the conscious mind. Also use the discerning mind. Find the most information you possibly can, and use that information to your advantage. Now, in my case, I'm initially getting a brow reshaping and a rhinoplasty, which was initially rejected, but I guess my doctor's going to be on a conference call to figure out why that's the case. And I may eventually have to get the chin done too, just to match. But that's a lot of surgery to have at once. Even though that's what I was going to do initially, I was going to get all of it done at once. Which I'm kind of happy we're not going to have to do it all at once. At least I don't think we are. I am going to talk to the doctor about that today, about what my options are for doing that. Just because I find that once you change one thing, another thing has to change a little bit. Also, when things heal, once something is healed, you might have to go through and tweak it just a little bit, do some small revisions. Honestly, I wish that was the mentality with bottom surgery too. And this I lay full blame for at the foot of the insurance companies, because, we can't afford, civilians can't afford those kinds of changes. When I was getting my bottom surgery, there was only one doctor who did a two-stage operation, which is probably the best way to go. Dr. Metzger. But most insurances wouldn't cover the second stage. I don't know why. When we have bean counters decide people's health outcomes, it it leads to horrific, inhumane results. Anyway, I had bottom surgery and a one-stage procedure, which came out pretty well. I'm pretty happy with it. But I also went to, in my estimation, probably one of the best. I was going to go to Suporn for a long time, but then he got really old, and I didn't have to go to Thailand anymore because we had Obamacare. So I went to Marcy Bowers, and I just sort of lucked on to finding about her. I mean, I knew about her, but I hadn't really know the level that she had become until I went to this transgender symposium in San Luis Obispo with a friend. And then once I found out about that and all of the innovations she had made to the surgery, I was all on board. And then later on, after I had signed up, I discovered she was actually teaching the other doctors. So, you know, you want to find the doctor that's teaching the other doctors, if you can. It's a good sign. Anyway, my bottom surgery was about 6.5 years ago. I've been plotting out doing a video on that, just to follow up, because I don't know, I feel like I actually had a lot more to say in the year afterward, but now that it's a few years afterwards, in some sense I have less to say, in some sense I have a lot more to say, but I'm kind of digesting what needs to be said. I'll probably have to do multiple videos, because part of it is surgery, and that'll be one video, and part of it is emotional health and relationships. That's a whole other part of having bottom surgery that I think I will have to go through. I'm going to talk a lot more about the doctor today, but I'm expecting the main recovery to be about 2 weeks long. But he said there could be swelling for up to a year, which, you know, okay, I'm on board. I've been wanting this for so many years. What's 1 year? And I honestly don't feel like I'll really get a whole lot of benefit from this for a year or two. After it's done, it's sort of like planting a seed for the long term, because I think the changes I make now will have a huge impact on my future life. And I am hoping to look less like my grandfathers. So if you're any baby trans kids out there, please ask questions in the comments, and I will do my best to answer you. I'm really doing this for the help the younger generation as much as I can. Not for my own self-care, but also see if there's any way I can pass along my own hard-won knowledge. And years of obsessive research. So many years of obsessive research, because I've been researching this since I came out to myself, or just before I came out to myself even, I guess, say 1995, 1996. Before I realized I was trans, I had an obsession with being transgender that I didn't understand. Even though, in some sense, my subconscious knew I was always trans through childhood. I remember having a dream about changing my sex when I was 10 years old. That's why I call myself transsexual, because I didn't change my gender, I changed my sex to match my gender. Originally transgender was more for cross-dressers than it was for medical transitioners like myself. So I'm sure I'll shoot a little follow-up after my session. So here I am, ready to take my CT scan and see the doctor. Hopefully this all goes well. So I had my pre-op appointment with the doc, and overall it went pretty well. I continue to be impressed with this doctor. He seems pretty awesome. And he had just gotten off the phone with the doctor for the insurance company, who told him that he actually wants him to contest it, as do an appeal, because the language they have currently as the insurance company is very vague, because they have all of these hoops you're supposed to jump through, but then there's a piece at the bottom that says, well, they can just ignore that anyway. So we're definitely going to do an appeal. I have a lot of documentation, and I'm going to get a couple more letters, the letters from my psychiatrist and therapist. Hopefully that will help. He said there's a lot of aeration in my upper sinuses through here. So I got some big old mamma jamma sinuses in there. So they can only do so much, obviously, and they don't want to interfere with the brain, of course. Understandable. I'm all down with that. But we'll see what they can do. We may have to push my surgery date. I had been scheduled for the 9th of September, but now that's kind of in question, is if we can get the appeal process handled in that time. I'm hoping just having the whole team working on this will make it happen. And also, please may my angels help along with it. I do hope so. The angels are amazing what they can do once you ask them for help. But you gotta ask. Anyway, so I'm heading back to my little town out in the woods, which actually I'm really appreciating. I just went to a Wegmans for lunch, because I've never been to Wegmans before, and good lord, that place was huge. So many people. It wasn't even crowded, but there were just so many more people than I'm used to. It's just like, yeah, so much social anxiety. I've never had agoraphobia, but I'm starting to have human phobia, it seems like. And having unsympathetic parents hasn't been helping. I feel like I've worn out my welcome where I'm staying at my parents' place. Even though I'm not in their house, I'm just, living in a tent in the pole shed. That seems to be pushing my dad's buttons. I really wish he wouldn't have expectations on how I was supposed to live my life, because I'm never going to live up to them. And I wouldn't want to. I mean, I have to live my own life. And the only thing expectations are good for is having metrics for your failure. So if you have expectations, you're really only guaranteeing yourself to have disappointments. It's sad. I suppose that's part of being a dad, though. He feels, he wants me to be successful, but he doesn't realize that I am being successful. It's just not on what he was raised to believe is successful. I feel like I'm very successful. But, it's not in a conventional way. Very unconventional. And it will be that way. So I hope we can work it out. I think we need therapy. In fact, I know we do. I know that'll help. But I'm also thinking I should try and see if I can get rental assistance to get a place of my own to live away from them. The only downside of that is most of those places aren't in the middle of the woods, which is where I want to be. I really don't want to go back to a town, much less a city. That just seems like a horror show at this point, especially in COVID world. And I think that's partly my dad's problem too, is he's lived all of his life in the pre-COVID times, and just a small portion in the COVID era, and it's hard to understand how much everything has changed. We all have things we have to work through in our lives. This is one of mine, and it's one of theirs. Life is full of challenges for everybody. And we have to work through them as best as we can. And it's hard when people have their minds stuck in one certain way of how the world is. My stepmother keeps talking to me about how much she would want to have plastic surgery, but, I think she should be covered for plastic surgery too. I think everybody should be. We should all be allowed to have as much plastic surgery as we want. I mean, fuck yeah. This whole medically necessary bullshit is just that. That's poverty. That's a poverty mindset. It's a total poverty mindset. And it's so easy for people to have a poverty mindset. It's like, oh, well, I only have so much money, I can only do this. But we're only limited by our imaginations. If you can come up with it in your imagination, you'll find the way to make it happen. It certainly has worked for some things with my life, like being trans. But, your attention has to be there, and you have to be focused, and you have to know exactly what you want to the minutest detail. Otherwise, it's rather difficult. But that's just reality. If you want to craft your reality, if you want to make your reality be what you want to, you have to have a very clear concept. You have to say, okay, this is what I want. I want to work at a boutique. This is just my own personal example from a few years ago. I want to work at a boutique architecture firm with people who used to be involved with CCAC, like me, the kinds of people I grew up with. And then, from there, I crafted my reality some more. So I decided, as great as it is living in Alameda, I do not like this commute, so I want to live right next to work. And there are some apartments right down the street from my office. So I was looking on Craigslist and I found one of the apartments in the apartment building I had noticed that was between the office and the bar we used to go to, a block away. But I think there was probably some angels involved with that one too, because not only was my home and office on the same street in San Francisco, but so was the project. And I think there was definitely some karma I had to work through with my ex-boss. I don't know if we managed to succeed in that, but we did some stuff. We changed it for whatever good that is. I'll probably still see him in the next life, though. I don't know if I have anything else to say. Other than I'm glad I'm staying sober, because I don't want to. It's been about, let's see, this is the 8th month, and that means I am coming up on my 7th alcohol sobriety month, and 5th cannabis sobriety month. But I have to say the thing that probably triggered me the most is just my dad being upset. It's making me want to drink again. And when I mean drink, I mean drink to the point of death. So I hope we can work it out. And even if we can't, I have to stay sober. Yes, 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 I have to stay sober. Living in a whiskey bottle is a terrible way to live. It's such a lovely day.